He is the head of hospital relation management in Kerala.
Thank you, sir. See, Star Health, we have a very simple procedure for empanelment. We don't need any third-party agencies or any expert to get into Star Health network. You have to go pms.starhealth.in. You have to type pms or starhealth.in, or you can type our website starhealth.in. In that, if you scroll down, you will have a features of new network hospital empanelment. There you can click, directly go to pms.starhealth.in. In that, you have to give the hospital name and address and email ID and contact number. Only the simple thing, hospital name and address and email ID and contact number. In the email verification, you will get an OTP. In the OTP, you will be able to log in for the empanelment. It's that much simple. They upload few documents related to the hospital. That is the hospital registration certificate that every hospital should have, and the pharmacy license, the pollution control certificate, and the KYC details of the hospital. It's a PAN card and any ID proof regarding the KYC. And for the fund transfer, we need to have a copy of the checkbook or these details of the check we need, and the package rate and SOC you need to upload. After that, from the Star Health, we'll have a infrastructure verification. It's mostly done by online or by physical verification. If the network coverage or something it is wrong in that hospital area, we need to get it in a physical verification of the infrastructure verification. That's all. The hospital is empaneled. It's that much simplified procedure. No need to have any third-party agencies to go for empanelment. Most of the hospital, if they feel it's very difficult to get empaneled with any insurance company, Star Health will have a very simple procedure. You can empanel with the mobile. With a simple click of mobile, you will be able to empanel a hospital. I would like to Dr. Sandeep Kudlu is heading the medical head of the Star Health Kerala zone. I'll hand over for next section. Also, I'll show you some package rate regarding the ophthalmology. You can see the package, how the package rate would be done. It's the sample only that cataract, excluding lens, cataract excluding lens, vitrectomy. Some procedures we have a daycare, and the amount we have agreed with the hospital. And mostly hospital give you a 10% discount for the not to Star Health. Will give you for the patient a 10% discount. It's excluding the ANH package rates. Thank you.
Thank you, Dr. Abhilash. Good afternoon all. So today I'm going to explain some small policy conditions regarding ophthalmic procedures and all. So as you all know, we have a waiting period for some of the ophthalmic procedures like cataract and anterior and posterior chamber of the eye. So after taking the policy, we'll have to wait for 24 months to get these procedures covered. And the treatment and complication of endorsed PED. PED means pre-existing disease. For example, someone is having diabetes and he is disclosing while taking the policy. It has to be mentioned in the proposal form. And after, based on the policy condition, it can be covered. The complication like diabetic retinopathy and all, it can be covered after 12 months, 24 months, 36 and 48 months based on the policy type. And the treatment of non-disclosed pre-existing disease. The same example, you can tell that the diabetes is non-disclosed. He's having diabetic, but he's not disclosing. And he's come for a diabetic retinopathy in 4th year of policy. But what we'll do is we'll reject the claim, stating he has not disclosed the diabetes since he has admitted for diabetic complications. So what we'll do is we'll endorse the diabetes and his complication at that time. And after that, he has to wait for 48 months or 12 months to get the coverage for complication. And the next one, there is a waiting period is applicable for enhanced sum insured. That is, someone will be having a 3 lakhs policy. In 3 lakhs policy, the sublimit for cataract will be around 15,000. So next year you want to go for a cataract surgery. So suddenly he will increase the sum insured to 10 lakhs. Where will be the limit will be around 75,000. So immediately after enhancing sum insured, he won't be getting that full sublimit. He'll be getting the sublimit of previous policy sum insured. And next, no claim will be entertained. There is a suppression of decline risk. Suppose the patient is admitted for, most of the doctors are giving letter that now the patient is admitted for cataract. Why you are asking for the details of heart disease? This is not like that. We have some of the decline risk as per our internal guidelines, that is cancer, CVA, CAD. If all these things are pre-existing disease, we will not issue the policy to the customer. And these are some of the example of sublimits based on the sum insured and the policy type. Like you can see the 1 lakh sum insured, the sublimit will be 12,000. But the specialty of in senior citizen only, we have the sublimit for the policy period. But in most of these things, we have for one eye and both eye, the limits are based on the sum insured. And as per the new IRDA circulated on the 2020 October, so we have started covering some of the modern treatment. In ophthalmic, we are covering the intravitreal injection. So for that also, we have a sublimit based on the sum insured. Thank you.